activity, right? And then what is emphysema? Well, emphysema is also associated with smokers, but there's primary and secondary. So let's talk about secondary emphysema, because primary emphysema is a deficiency in an enzyme that we call alpha-1 antitrypsin. That deficiency will lead to destruction, or the inability to prevent destruction of the alveoli. So emphysema, secondary, contributed to a lot of times cigarettes or smokers that have been smoking for many, many years. And it is destruction of alveoli. So we're going to say destruction of alveoli. And that means decreased surface area. What does that mean in terms of oxygen diffusion? Well, it means that if I have less area to diffuse, then I'm not going to have as much oxygen crossing over into the body, and I'm going to have trouble breathing. How do you treat? Primarily, you want to increase the oxygen going into the body. So maybe you give somebody an oxygen mask. You give them an increase in the pressure of oxygen, and therefore it pushes across the alveoli that are still there and pushes into the body so you can breathe again. Some of the other things in general, right? We talk about the airways, and I did this for the pharmacology of it. 3 factors we're looking at: bronchoconstriction. I want to fix that with bronchodilators. Mucus production. I want to fix that with mucolytics. And acetylcysteine, oftentimes you'll hear that with treatment for someone who's overdosed on Tylenol, but it's also, brand name is Mucomist, so it's also a mucolytic. It thins out the mucus that you have. And then the last one is airway inflammation. And so these are 3 things that I would look at for any one of these, for asthma, chronic bronchitis, or emphysema. And these 1, 2, and 3 are possibilities for treatment, and I'm not going to go over that because I already have a video on it. Okay, hopefully that was quick. That wasn't really quick. That was like 7 minutes. Bye.